Okay, there's an exciting new area in surgery, which is a further development of laparoscopic surgery. And it's got a variety of new names. If you look on Google, you can look up SILS, S-I-L-S, for single incision laparoscopic surgery. You can look up TULAP, T-U-L-A-P, for transumbilical laparoscopic procedures. You can look up invisible or cosmetic surgery or scarless surgery, so there are no scars. And this area of research basically is trying to do something pretty simple, which is we have had some advances in medicine, and you can see them in new kinds of kidney transplantation, things like that. But one of the big ones that a lot of people know about is the change from open cuts, big incisions, to doing surgery through little ports. And of course, the mini-gastric bypass was one of the first advanced laparoscopic techniques to take advantage of doing really complicated surgery through laparoscopic small ports. And we're pretty happy with the cosmetic results, but the question arises, could we do the whole surgery and make it either invisible or almost invisible? Could we get rid of some of the other ports and maybe put everything through the belly button? There are doctors who are trying to work and operate through your mouth. So they've actually put tubes down through the mouth, opened the stomach, wandered around through the abdomen, taken out the appendix, closed up the stomach, and then taken it out. So there's a video on the internet, if you have a stomach for it, where the guy in India puts an endoscope down, punctures the stomach, goes and finds the appendix, cuts that out, and brings it out through the patient's mouth while they're asleep. Now that's scarless surgery because there's no cut on the abdomen, and it's also called NOTES, for natural orifice transesophageal endoscopic surgery. And NOTES is interesting, but it's still in its early phases. But the single incision stuff is pretty interesting, and our surgery is already pretty good as far as making small incisions, but we wonder, could we advance to a TULAP or a minimal surgery that leaves behind very little in the way of scar tissue and make it almost invisible? And the answer is we think we can. We've done a couple patients now where we've modified the surgery, used tinier ports and things like that. And we're now working with the hospital to get some of the latest equipment to really shrink down the incisions that we use. The incisions that we use on most of our patients up until we started doing this are 12 millimeters in length. 12 millimeters is pretty small, and maybe later in this video we'll show some pictures, because we have had a lot of people volunteer and send some pictures back of their abdomen and what the scars look like. And we actually have some post-op patients here today. We might see if they're willing to share their scars with us on video. What we do then is say, I wonder how good we are now. What do patients say about their scars today? So this past weekend we sent out a survey, and we've gotten answers back from a little over 55 MGB patients. And what the survey says is, we asked them, are you pleased with your MGB scar? And what do your scars look like after your MGB? Okay? Now these patients, most of them are 2009, and if you're under a year out, the scar really hasn't matured enough to really begin to really melt away. So some of this is going to be even better, but the results are pretty good, and I thought I'd report them this morning. One of the questions we ask is, what are your scars like after your MGB? Okay? We found that by report, 7% of patients said, my scars are invisible. So 7% of patients after their MGB said, my scars are invisible. 50% said my scars are almost invisible. In other words, they're pretty good. About 38% of patients said my scars are pretty easy to see, pretty easily visible. And 2 people, or 3.4%, said my scars are large and ugly. So we failed that person, no, those 2 people. On the other hand, if you take 98%, that's pretty good, but there's still room for improvement. Now we asked the patients, given that report, we said, are you pleased with the scars overall? And we found that 51% said, I'm very pleased with my scars. We had somewhat pleased, 24%. And we had, I'm neither happy nor unhappy in 13%. And I'm somewhat unhappy in 8%. And I'm dissatisfied in 1%, 1.7%. So I think that means that the surgery is pretty good, but I think there's room for improvement. And so we are going to be announcing on this video and upcoming that we're going to be offering what we're going to call the micro mini-gastric bypass. And the idea there is we're going to move the ports down, we're going to use smaller ports, and we're going to be aiming towards an invisible gastric bypass and invisible sleeve type surgery for kind of thinner and healthier patients. So that's our announcement this morning. Will be more coming about that, and we'll talk to you soon. So thank you very much.